Here's my 5 best tips for studying anatomy and physiology. Pay attention if you're a pre-nursing student or a current nursing student. Number 1, divide and conquer. As you study each body system, don't look at the whole thing and try to memorize everything. At least not all at once. Separate it into segments. For example, the skeletal system can be split up into the skull, and then the chest, and then the arm. Number 2, study each body system in layers. After you've divided things into segments, now we're going to do layers. Focus on memorizing the individual components, like the big components. Like for skeletal, what is each bone's name? Let's start with that. Once you feel kind of comfortable with that, then you move on to the second layer, which is going to be things like landmarks. Where are the fossas and the foramens, the condyles, things like that. You'll find that once you have the main thing memorized and then layer it with the landmarks are going to be much easier to remember. Tip number 3, now you go back and you figure out, what does each of these things do? What is their job? And you have to put it in your own words like you were explaining it to a 4th grader. Because if you can explain it to a 4th grader, that means you really understand it. And if you understand it, you're going to remember it better. Tip number 4. This is a general memorization strategy, but you always remember things better when you study them in short, frequent chunks. So work on the section that you're trying to memorize, do it a few times, then take a break and move on to something else before coming back to it again later. It doesn't mean you should only do it once per day, but it could mean, like, if you're going to study the skull, do that a few times, then move to the chest a few times, and then study the arm bones a few times, and then go back to the skull. Tip number 5. This is kind of a bonus tip. If you want to start setting yourself up for success in nursing school while you're still in your anatomy and physiology prerequisite, then you're going to want to do this. It's basically starting to use the 4 steps of the silver bullet study system as you learn the anatomy and physiology. Almost everything you're learning in anatomy and physiology is going to be in step 1 of the silver bullet study system, which is why there's so much memorization. But once you've got it mostly memorized, you should and can and should go through steps 2 through 4 as well. But only spend like 5 minutes. You don't have to spend a lot of time on this, but it's going to make so much difference. It's going to make thinking like a nurse so much easier when you finally start your core nursing classes. You do it this way. You say, step 2 is what's broken or changed. You say, based on what I just studied and memorized, what would happen if the skull was fractured? Well, since one of the jobs of the skull is to protect the brain, well, the brain's not going to be as protected. That's our prediction in step 3. So we basically say, what could break or change in step 2? And then we say, what's going to happen as a result in step 3, and say, what are we going to do about it in step 4? Well, we're probably going to do things to try to fix the skull and maybe wear a helmet next time. It doesn't take long to do this, and it can, like I said, it gets your brain used to thinking the same way that you're going to be required to think in nursing school. If you need to learn more about the silver bullet study system so that you can be working on this, you can get a free 10-minute overview video. The link is in my bio, or you can just go to www.yournursingtutor.com/SBSS to get that free video. And make sure you give me a follow so that you can get more nursing school tips.